Hi, welcome to Suzanne's Real Life Real Estate. I'm Suzanne Prezio. And as you know, this is a program that really isn't about real estate, it's about our community. And each week, I introduce to you a member of our community who has a business or a service to provide. And today, I am very excited to have my very own dentist, Dr. Gabe Mcgarry, and his partner, Dr. Deborah Bausback. Welcome. And thank you so much for coming on Real Life Real Estate.
Thanks for having us.
Yes, thank you.
So I appreciate it. I'm sure that, Fridays, I think that's when you're doing all your paperwork and all your follow-up. And, so I appreciate you taking the time to be here. Sure. And I will say this again during the podcast, but the office is at 840 Kenwood Ave. Is that considered Slingerland's or?
Yeah.
Okay. Phone number, 518-439-9939. They most certainly are taking new patients because I have had how many people call me in desperation and say, do you know a dentist? And by the end of the day, they're calling me to say, thank you so much. They got me right in.
Oh, that's great.
I do appreciate that. And how many people do you have on staff?
We have myself and Dr. Bausback and 10 employees. So four dental assistants who help us out directly, 3 front desk staff, and 3 hygienists.
Okay, because that's impressive in that I've never had to wait. I'm never on eternal hold. And it just fascinates me that, because you're a busy practice. I mean, when I go there, there's always people coming in and out, but nobody's ever hanging around waiting. And this is pre-COVID. It's efficient. It's efficient. And I know it's a fun place to work because you don't have a lot of turnover. When there's not a lot of turnover, that means it's a happy place. So,
yeah.
And I appreciate that because if people are putting sharp things in my mouth, I want them to be happy. So, Dr. Bausback, I'm going to start with you.
Sure.
Where did you study and where are you from?
I grew up in Slingerland's.
Oh, okay.
So I'm practicing about maybe a little over a mile from where I grew up. And I went to dental school at the University of Connecticut and did my general practice residency at the VA hospital in Albany. And then started working at the location I am now.
That's great. That's great. So you're a hometown girl.
Mm-hmm.
So I love my 518 people. Dr. Mcgarry?
Yeah, similar. I went to Burnt Hills, grew up nearby, went to dental school at UB, SUNY Buffalo, and then did a residency at St. Clair's in Schenectady. And I spent the first 4 years with Dr. Tramontana in Colony. And then I joined this practice in 2007. And then Dr. Bausback and I have been partners since 2012.
Mm-hmm.
So,
because that's actually how you and I met.
Yes. Yeah.
You had started there, and then he was retiring, and I somehow came across your name and said, "Oh, that's a no-brainer," and we've been together ever since. So,
right.
So now you've been at this location for how many years?
Well, since 2007, so
07.
14 now this November.
Okay. Wow, that's
doesn't feel like it, but
no.
Yeah, and that's one of the first things I noticed when I came over was the lack of turnover. We had a lab technician who had been there. Well, geez, she
42 years.
A total of 42 years.
Yeah.
So, yeah, she retired after 42 years when I was 43. So,
Oh my gosh.
but so and that a lot of long-term employees, and so one by one now we're seeing them retire. So, but it's a good environment.
Yeah, well, that speaks volumes because, and especially for people who have anxiety about going to the dentist. I mean, I'd love to go to the dentist, but I didn't always. And I would say that changed when I started going to Dr. Tramontana. I mean, he was wonderful. He was a very good dentist. But if you get in the wrong hands, it can be a traumatic experience.
Yeah. And it can be a lifelong problem if something happens as a child. We see that pretty routinely. And then so part of our process in dealing with those patients is to try to work through it and undo the the psychological trauma that has been done. And it usually just starts with a new patient questionnaire. You know, we always ask them before we get in a treatment room, we like to sit down and talk and ask them about their history with dentistry and uncover some of those things before we even break out the mirror and explore, you know.
Yeah, well, yeah, you actually do a consult where there is no exam. Because I brought my mom as a new patient, and then it was really just a meet and greet and
Right.
work through any prior medical conditions, and you know, so it's thorough. I don't think people give dentistry enough recognition that I mean, it can be an intense medical procedure sometimes.
Mm-hmm. Yeah.
So,
And I think we also like to try to let our patients know everything that's going to be occurring before it happens, so that there's no surprises. And that's one thing that we train our staff to do as well, and you know, try to make everyone as comfortable and feel like they are in charge, which they are, and allow the patient to you know, feel like they're an active partner with us in formulating their treatment plan and doing their treatment.
and as a patient, I appreciate that, because even during the procedure, I mean, because Dr. Mcgarry, you and we've done a couple of different things to my mouth, and even while it's going on, he lets me know, this is what we're doing next. This is what I'm doing right now. This is what, and it's, and even before I'm in the chair, I know how long I'm going to be in the chair. So, you know, when a lot of times people want to know the timeline, setting expectations, I guess is what we're saying.
Right.
So,
I noticed that for the first time. I had a young boy he was on the spectrum. I think it was Asperger's or a form of autism. And the mom said, he'll be fine. You just have to explain everything you're doing. So first we started with a photograph or an x-ray of the decay. I can't remember exactly what it was. And I walked him through the whole process. And once he understood all the steps, he was fine.
Exactly.
You know, oh, you're going to do this, then you're going to do that. Okay.
Yeah. Well, don't you think you learn with every patient?
Oh, yeah.
I mean, I know with every home I sell, I've learned something, either about people or about I'll say the product. And I would think every case that you handle,
Sure,
you walk away learning something,
oh, sure.
you know?
Yeah, I didn't realize it in school or getting into this, and maybe you can speak to it too, Deb, but you have to put on your psychologist hat sometimes. And so a lot of times that anxiety presents as anger or frustration. And it's not, the patient's not necessarily angry or frustrated with you. They're just fearful of the unknown, and they're not sure what to expect. So, you know, it all comes down to communication, really.
And it's true. Again, my industry, same thing. I had a manager, Mark Phoenix, and he said, we don't see people at their best during transactions.
Mm-hmm.
It's a very emotional thing, selling or buying a home, and we don't see them at their best. And there's a lot of people I cut slack because they normally wouldn't be like that. It's just they're afraid or overwhelmed or don't know. So, you know, you see the same thing. So let's talk about some of the, you know, being in the trenches here. How often should someone have a cleaning?
Well, I mean, that's there's more than one answer to that question.
Okay.
The average person, you know, every 6 months is the accepted you know, norm. But that just addresses a certain percentage of the population. There are conditions, oral conditions, that could mean someone should be coming in every 3 months for a cleaning. And then there's those rare situations where, you know, every 6 months might be too much for a particular patient. But, you know, Gabe, feel free to interrupt, but I think it's something that you have to customize per patient, and it can change. It may start out to be twice a year for somebody and move up to more often, or vice versa.
Yeah, I think in terms of dental diseases like tooth decay, periodontitis, there are risk factors such as smoking, diabetes, certain genetic factors. And if you have one or more of those, you really need to come in more frequently. But we're not just taking x-rays and doing cleanings, we're checking for oral cancer. So I think it behooves most of us to come in twice a year to stay on top of those things.
I love to get my teeth cleaned. I do. And look, with the pandemic, that the appointments were pushed so far back, I could not wait to get in there. So how badly did that affect you as far as putting you, I'll say, behind, for lack of a better way to?
Well, I think we're still dealing with it to some degree. We're still playing catch up. I know we're both occasionally helping out with doing cleanings here and there. We have one of our hygienists coming in on Friday mornings when the office is generally closed to catch up. But it's evening out. And I think with the COVID protocols, we reduced the number of patients we see each day to allow for more time between patients. So it's probably, that alone is probably going to contribute to us taking longer to catch up.
Okay. So you treat adults as well as children.
Mm-hmm.
And I have here, are there any specialty areas that you would say that your office excels in, as far as, we discuss people on the spectrum, special needs people, diabetes patients. Are there any patients that you feel your practice kind of specializes in? Or you pretty much got them all covered?
Well, from my perspective, I think we're general dentists. And so we do a pretty good job at seeing everybody. Our youngest patients are usually, around 2 or 3. They come with mom and dad.
Oh, wow.
So, and we accommodate those with disabilities and handicaps, but to the extent that we're unable to help somebody with a severe condition, then we would make the appropriate referral. There's pediatric offices that do great with kids with special needs. I don't know if you want to chime in on that, Deb.
Well, I think that's part of our responsibility as a general dentist, is to know when a particular patient or a particular procedure needs to be referred out to specialists. And we have a great network of specialists that we work with, and where we communicate back and forth, almost like sometimes we're the quarterback of the team, and have to make sure that patients are going where they need to go, and that in a timely manner, and following through with it.
Okay. All right. And so I just learned something. I didn't realize you took patients as young as 2. That's good to know. So we talked about anxiety going to the dentist. And so dental phobia is obviously something that you're well aware of. You always wonder, you don't know, because the dentist is such a, the dentist, in such a, one-dimensional, that you don't realize that the dentist gets it, are there relaxation or sedation techniques to ease a phobia?
Well, in my experience, we talked about that earlier, starting off with the communication. Have you had an unpleasant experience in the past? And people will either say no, or they'll be very specific. They'll tell you exactly what happened and when. And we really sympathize with those cases. In most of those cases, we can, through communication and explaining what we're going to do, and acknowledging where they've come from, we can usually get through without any sedatives. We don't do sedation dentistry per se, but I do have a handful of patients who will take an anti-anxiety before they come in, and that really helps them to overcome, because some of these cases, they've been so traumatized, even when you get them comfortable and you give them a comfortable injection and they're numb, the sound of the dental handpiece might bring them right back. It might trigger a panic attack or something like that. So even though you can do your work comfortably, it's tough to mitigate the trauma of the past. And that's where some of those anti-anxieties come in. And then, for some of those patients who have a tough time even getting in the door, that's why sedation dentistry exists. There are some offices out there that will do everything for you while you're sedated.
Okay. Continuing ed, are you required to take continuing ed?
Deb, I'll let you handle that one.
I actually couldn't hear the
Oh,
question.
continuing ed.
Oh, what was the question? Sorry.
Are you required to take continuing ed?
Oh, yes. We're required to have 60 hours of continuing ed every 3 years to renew our license.
Okay.
Yeah.
All right. That's actually not so bad over a 3-year period, though.
Yeah.
And all right. So when I do these interviews, I Google things, and I saw this question on the internet. How do I improve my smile? So there's a question for you that someone may ask you. So how does someone improve their smile?
It's a simple question, but it could have a complex answer.
Yes.
There are certain conditions like gummy smile, where I forget the percentage now, but a large percentage of the gummy smile cases could be resolved with a little bit of Botox or gum surgery. So it's not always. Yeah, I mean, it depends. How much tissue is showing when smiling. It may not be a matter of fixing the teeth, but moving the teeth or doing jaw surgery or some sort of soft tissue procedure. And so we really have to look at everything. That's why one of the first things we do when we greet a new patient is we'll take photographs so we can see where the teeth are in relation to other facial features. We do an analysis of the bite itself so we can tell if there's any orthodontic problems, look at the jaw joint, see if there are any discrepancies between the teeth and the joints. And so it really depends case by case how you would improve your individual smile. I don't know if you want to jump on there, Deb.
But it's such a broad range. It could be something as simple as whitening teeth. To a patient might just have a couple of older fillings that are discolored, and replacing them, meets their expectation of improving the smile. So there's so many different things that could be responsible for a particular person not being happy with their smile, and it's not always the same treatment or answer for every person. And that's part of why we have the initial discussions with patients, because there's often several options even to address concerns a patient might have with aesthetics of their smile or treatment really of anything they're concerned with.
And a lot of times we might see something that we don't like and the patient doesn't mind at all. So when I get that question, I have to turn it around and say, what don't you like about your smile? Because we may be talking about two different things.
Mm-hmm.
Like the old nip tuck, tell me what you don't like about yourself. What would you say is the most popular cosmetic request? What I mean by that is, do you have people that come in and they are looking for like Invisalign, or they're looking for teeth whitening, or looking for veneers? What do you find to be the most popular?
Probably whitening in general. That seems to be the most often request, but all that you mentioned is brought up to us at some point every week. Yeah. Especially with all the Zoom meetings that are going on. I think people have seen themselves up close a little bit more often than they were used to. So we've had a lot of people bring things up since COVID because of Zoom meetings.
Yeah, I read an article about a woman who was having difficulty with Zoom meetings because she didn't like looking at herself.
Mm-hmm.
And I thought, that's awful. That's just awful so, but there's nothing like a nice smile. I mean, I remember I went on a job interview. This was forever ago. I didn't get the job, but the guy said to me, "You have great teeth." I was like, "Well, thanks. I would have preferred to get the job." Actually, no, I prefer to have the great teeth. So obviously diet impacts tooth health, oral health. So common sense, right? Sugary snacks, acidic foods, a lot of caffeine, they're all going to cause chaos. Anything, if you could give a public service announcement to the community about something that they may not even be aware of that could be affecting their dental health, what's the one piece of advice you would pass on?
Well, personally, I've done a deep dive into nutrition in the past few years, and I would say a good rule of thumb would be to get rid of hydrogenated oils and refined carbohydrates. I mean, if there's a lot of different diets out there that work, but a diet that's low in healthy fats and high in these polyunsaturated fats and refined sugars is proven to create chronic inflammation, let alone tooth decay and gum disease like that. But I think dentists have been in a unique position because we've seen directly the effects of a bad diet on the teeth. And now we're finding out that same bad diet can have systemic effects. So, whether you're vegan or a meat eater or whatever it is, if you can reduce I call them Franken oils, but the hydrogenated, nut and seed oils like soybean oil, canola oil, things like that, and the refined carbohydrates, fermentable carbohydrates, you should be well on your way to reducing your risk of disease and chronic inflammation.
Interesting. All right. So stick with the olive oil. Is that what
it basically comes down to whole foods, unprocessed foods. So the best oils that I know of are olive oil, avocado oil, unprocessed, unrefined coconut oils, things like that. And it's tough. You look in your fridge or your pantry, all your condiments, all your salad dressings, they're all got all these oils in them, and it's not easy to eat well. If you're not a meat or fish eater, it would probably help to take an omega-3 supplement. One of the biggest problems with the modern diet is it's too high in omega-6s. So if you can get your 3s up, that'll help. And we've known for a long time getting rid of the sugars would be good. So it's just tough for a lot of people. I think I read a line recently that said they were talking about the obesity epidemic in America, and we are overfed yet malnourished. And that line stuck with me.
Oh, wow.
And it's this lack of nutrients that contributes to a lot of the disease, including periodontal disease, which is a gum disease that's a chronic inflammatory condition. So,
yeah, and I know you take very good care of yourself because you're a runner, and you and I are always discussing the latest nutritional road to success or whatever. But now, Dr. Bausback, I'm going to put you under the hot lights. What if you could give a public service announcement? If there was one thing you'd like to see your patients diligently follow, what would benefit them?
Let's see. Well, obviously, being the first thing I would have mentioned, it kind of was touched upon by Gabe already, is just cutting sugar, out of your diet or down, as low as possible, because that's just the one thing that does lead to decay. And but other than that, probably, I guess probably the most important thing, which is very simple, is making sure you come in and see us, twice a year, because of it may not seem like much at the time, but because of all those things that we mentioned before, where we're not just looking for cavities, we're looking for gum health, oral cancer screenings, checking the bite, wear on the teeth, which is something we see all the time, joint health. There's so many things we're looking at, and most of these things, as they degrade or progress, it's usually not obvious to the person it's happening to. A lot of these conditions, such as periodontal disease, are often considered silent, that you don't necessarily feel them occurring until it's too late. So it's just important to come in regularly and be happy when we don't find something. But that would be, I guess, my recommendation.
Okay. And I want to just give the office address and phone number again. It's 840 Kenwood Ave in Slingerlands, and the phone number is 518-439-9939. You can always call me at 518-577-6571, and I will get the information to you. So going back to teeth whitening, I've heard healthy teeth aren't white. Now, does whitening the teeth? Does it weaken them? Is it bad for them? Or is there too much of a good thing?
Not that we know of. Most of the whitening agents are a form of peroxide, which just lifts stain out of the enamel. So the whitening gels we use are a little bit higher in peroxide than what you can find with the over-the-counter things like the Crest White strips or things like that. No, I wouldn't say overly white teeth are a sign of a lack of health, but they certainly could indicate something unnatural. If we see somebody whose teeth are too white, something just doesn't look right. It's like we violated one of those aesthetic norms. Because you can have teeth that are extremely dark and yet still healthy. I think you can also have extremely white teeth and maintain that health. But whitening does come along with sensitivity generally. So if you already have sensitive teeth to begin with, it might be a challenge for you.
Okay, all right. Now you've talked about periodontal disease, oral cancer. These could be conditions that people have that they're not even aware they have, correct?
Right.
Mm-hmm.
So is there anything someone should be looking for to like that? Is there some sign that, hey, this isn't normal, something's not right here? Would it be like, if your gums are bleeding all the time, or?
I think most of the pathology we see is something that you would be unaware of. Even tooth decay. We see decay all the time, and it's usually not until the cavity is very large and approaching the nerve that you would have any symptoms. But we can also see signs of grinding, which is something most people wouldn't be aware of, and that could be related to a sleep disorder. A lot of times people aren't getting good sleep, and then it triggers a grinding episode. So it could be related to stress. But yeah, I would say most of what we see, even infections, sometimes infections have no symptoms. You take an x-ray and you can see an abscess forming and the patient has absolutely no symptoms. So I don't know, you want to chime in there, Deb?
No, I agree. Obviously symptoms do occur, and we'll have patients call us because they're having a problem, but a lot of times it doesn't. So, it's just, again, another reason it's important to have regular visits.
COVID. How has it affected dentistry? Has it affected your practice, your patients?
Well, I think it's obviously affected all of us, on many different levels, whether it's at home or at work or just, dealing with the pandemic as a whole. Fortunately, in dentistry, a lot of the regulations that were recommended for us when COVID came along, we were doing already. Our infection control and mask wearing and how we clean the operatories and prepare in between patients. So a lot of it was in place already. And then we had to change some of the ways that obviously we are no longer utilizing our waiting room the same way we would pre-COVID. We're not seeing as many patients a day. We're having a couple additional personal protective wear that the employees wear, screening questions for patients before they came in. So a lot of logistic changes and also just volume changes. We're not able to see the number of patients that we would normally see on a regular basis. But, fortunately in our field, a lot of the infection control was already in place. So there was not much we had to do to change that aspect.
Yeah, and as a result, ironically, we have one of the lowest transmission rates in healthcare. We were predicted to be one of the highest because we deal intimately with saliva and we generate aerosols when we do our work. But I think because of all the infection control and the pre-screening that we do, bringing people in one at a time, things like that, has really reduced the transmission rate. And then as far as conditions, there was a poll done, I think in September, the Health Policy Institute, they just did a survey of dentists, and most dentists have seen an uptick in things like clenching, grinding, broken teeth, TMJ related problems. Now, that could be related to sleep disorders, which could be related to stress as well. So it's like a chicken and the egg thing, but a lot of dentists are noticing that. And I think the poll also included on the consumer side, they polled patients. And at the time, I think something like 20% of patients were still reluctant to go to a dentist. So we may, in the years to come, see some of the aftermath of that, people neglecting care.
Mhm.
But I think attitudes are changing, especially now with the numbers going down and the access to the vaccine. I think that 20% figure should be going down.
Okay. I know with the TMJ, you and I had talked about this before when we were chatting before Dr. Bausback came on. I was in excruciating pain. I mean, as far as like emergency, I need to come in, something is wrong. And you made me this little mouthpiece that just goes on my front teeth. And I had to wear that 24/7 for like a week. And it was like a switch went off. It just fixed what was ailing me. But that was pretty impressive that you just honed in and was like, this is your problem.
Yeah, it's nice when that works. I was telling Deb the other day, it's like a magic trick, this little thing. But it's all it is it prevents the back teeth from touching, which prevents the muscles from firing, and it kind of forces the system to relax. So it's nice when that works.
Yeah. I mean, that was an excruciating, just forget it. I turned into a werewolf. What's new in technology, in dental technology?
Well, I think as far as what's new, there's been technologies that have existed for a while that are becoming more ubiquitous, and we're seeing a conversion or transition from analog techniques to digital slowly but surely. I think we were at a lecture recently. They talked about this being the year that digital procedures overtook analog in terms of how we capture images and how lab techniques are making crowns and things like that. I think that's the big one.
Yeah.
Okay. All right. Well, before I let you go, okay, because I want to be fair here, I'm thinking of a number between 1 and 10. So both of you pick a number because that'll determine who goes first. Pick a number, somebody.
Oh, 7.
7. Oh, did you say 7 too?
Yeah.
Can we pick another number now then?
Yeah. Yep. Both of you pick another number.
3.
4.
Okay, well, 4 is my number. So, Dr. Mcgarry, dead or alive, if you could have dinner with anyone, who would it be?
Oh, boy. Oh, boy. Well, probably my dad.
Okay. Okay, that's a great answer. I love that answer. I love that answer. Dr. Bausback, what did you want to do for a living when you were a little girl? What did you want to be when you grew up?
A dentist.
Did you really?
Yes. Yeah.
That's beautiful. Two
Yeah.
great answers. So you just always wanted to be a dentist?
For as long as I can remember, I think around 4 or 5 years of age, I said I was going to be a dentist.
Did you have dentists in your family?
No. But my sister's one.
So you just grew up and were like, we're going to be dentists. That's
Yeah.
I love that. Oh my gosh. You know what? This just made my day. Well, thank you both so much. Dr. Gabe Mcgarry, Dr. Deborah Bausback. Again, 840 Kenwood Ave, 518-439-9939. Thank you so much for coming on to Real Life Real Estate. And I appreciate you giving me the time and telling the people in the community about what you do.
Thanks for having us.
Yes, thank you.
You're very welcome. Thanks so much.